Hey, welcome to another episode of Your Faith and Health Community. I'm your host, Pastor Jackie Jackson, and as always, on behalf of myself and our producer, Anita Alexander, we want to thank you for taking time out of your busy day to join with us. Hopefully, prayerfully, we'll give you some information that will definitely change the quality of your life. I want to mention something, and we have Marjorie Moseley with us here. This is my former work wife. You probably heard me say that before when we were with Enroll America. And she's here. We're going to talk about open enrollment that starts November 1st. So I'm not even going to start all on the health care. I just want to talk about something really quick. And it's something that I get asked about. And you probably noticed this. I don't know if this is considered a disability or whatever it may be, but I want to mention it because for some people, it may stop you from progressing and where you want to go. If you will notice, my left eye, it moves to the left on its own. I don't ask it to. I try to stop it. It just does whatever it want to do. I want to speak to people who may have some situations in your life that may make you feel like you don't want to step forward. I've had this eye for 60 years. Of course, as a newborn, I didn't know that it moved, but eventually I learned that it did because, you know, kids can be cruel. So I was called all the different things in school: cockeyed, wandering eye, lazy eye, sleepy eye. Never bothered me. I kept moving forward. I want to say this to you. If it's something with your eye, if it's something with your skin, if you have something that may make you feel like you need to feel inferior, don't do it. Go out and do what you want to do. Go out and be productive. Go out and date. Do a television show. Do a radio show. I guess it won't matter if you're doing a radio show. Go out and speak in public. Do whatever it is that you feel you want to do. Don't let it stop you. Listen, this never stops me. In fact, if I'm speaking somewhere or in a group, one of the first things I'll say, it's kind of my icebreaker. I'll say, hey, if you want to know if I'm talking to you, look at my right eye because my left eye confuse you. It makes people laugh. I know they're already thinking about it. So I just take away all of that. I just remove everything out of the way. We can go ahead on and do what we're doing because now you're not sitting there focusing on my eye, wondering who I'm looking at. This may sound crazy, but trust me, I'm not the only person in this world that's dealing with something along these lines. And I just want to say to you personally, go do what you're going to do. Elevate. Let that, if you need to, let that be the motivator to take you higher. Let that be the thing that make you say, I'm going to do it in spite of, regardless of it. Listen, God gave it to me. He knew it was going to be this way. He's not shocked like, man, what happened? What happened along the way? He knew. He meant for me to have it. Don't let it bother you. You are the best you are, regardless to what you may have, regardless to what situation may be in your life that somebody may feel like making fun of, acting confused, and maybe they are. But do your thing. It's on you. Got it? And I didn't even talk about health insurance on that, did I? Although, of course, if you have an eye like this, it's good to have health insurance because you can go get some help with it. You know, if you need some optotrictional help or whatever. And I know that wasn't even the right word. You're like going, dude, get your words right. I'm going to stop. And I am very, very happy to have with us Marjorie Moseley. She's here. We're going to talk about health care. We're going to talk about open enrollment. This is the seventh year, seventh year of open enrollment. I tell you what, I hope and pray that this under the people that we have up under the rule, who run this country, I hope that seventh isn't like the Bible and say completion, unless it is completion of the mess that they're doing, and 8 this next year going into these new beginnings where all this mess is done and we can move forward and make sure people are sure. How are you doing, Marjorie?
I'm fine, Jackie, and you?
I woke up. It's a good day.
It is a good day, definitely. The sun is shining.
And that's good.
Yes.
And it's hot in here.
It feels good in here to me.
So the sun must be shining in here. Oh, no, I'm sorry, that's the studio lights. I thought it was the sun.
Well, the sun is shining.
But I want to thank you for coming on the show. As always, whenever you're here, you bring some really great information. And people need it. And in this age of COVID, people definitely need health care. People have lost jobs or switched jobs. And, with all of this, with losing jobs for some people, that's where their health care was through. So now they're either going to Medicaid or they're going into the marketplace. And that's what we're here to talk about. So thank you again. Tell us about yourself.
Hi, my name is Marjorie Moseley. I am a federally certified navigator with the company called Resolute, HRS Resolute. And what we do is we assist folks with obtaining their health insurance and answering the various questions they may have, especially as we get ready to go into this open enrollment period. It begins on November the 1st. It ends on December 15th. That is so very important because in previous years it has gone a little longer, but it will be that time frame of November the 1st through December the 15th.
Okay, so November 1st, December 15th, so basically a month and a half.
Yes.
I remember 2013, we were blessed to be part of the pioneering group of getting this open enrollment going. And I remember that one lasted, what was it, from November all the way into
October.
March. October into March.
Yeah, because they had to extend the time.
Right.
Yeah.
And then it got shorter.
But it still was longer than this time period. It extend until at least January, if it was the end of January or the 1st of February. So the enrollment period has taken on some different directions, and COVID doesn't give us the opportunity to have various locations throughout our city to meet people where they are. But we want them to be able to know that this is happening. So if they need to change their provider, if they have lost their job and they don't want to get insurance because maybe they can't afford it, maybe this may be a great option for them as well as their family.
And because of only a month and a half to get this done, 45, 46 days or depending there, it becomes real important for people to act right away because you can't have all of these events that were able to be held up until this year. So this is mainly is it all by phone or video chat, or how's that done?
We do it by phone. We can do, if people want to call us and they walk through it with their computer, we can assist them that way. But we can't guarantee that we can do in person a lot of the times because we don't have the capabilities. We are looking to see if someone will open their doors or if they're willing for us to have an event where we social distance at that location. But one of our favorite churches that has been with us throughout this journey of healthcare has been Allen Temple, and I want to thank them for just being there for us. We're just not going to be able to utilize the church like we have in the past.
And I know Pastor Allen, he's an awesome guy. That's one of the things I really love about him and Allen Temple. They are willing to open their doors. But again, in this age of COVID, people you've got to be really careful. You've got to be smart in what you're doing. So that does hurt not being able to have these locations. But the good news is that there is still help in getting enrolled. And that's one of the things that you, through Resolute and all the your coworkers and the other people all around, that there's someone you can call.
Right.
And if it's Marketplace, it can reach out to you, but they can also call or reach out to www.healthcare.gov.
Correct.
As well.
And call the help center.
So they are still active as well.
Yes, they are. They're still on the ground.
Okay. But let's talk about, so Resolute, what is the process? I need to get health care.
So the things that you need to do is, the first thing, if you need health care, you need to know your doctor, if you have any medications you need to continue to take, any specialists that you need to have a relationship with, you need to have that information readily available. You know, your income, your social security number, phone number, address, email, those types of things you need to have. If you don't have an email, 9 times out of 10, we as navigators, we will assist you in creating an email that you utilize for the purpose of the marketplace.
All right, so let me ask you this, and I think this is an interesting question, I think. What are some of the obstacles that people will run into? And I guess that maybe that's going into being prepared. Let me change that way. What should people be prepared to do in both instances, for Marketplace and Medicaid, so that way if they get you on the phone, or if they happen to get an in-person register, someone to help them register, what do they need to be prepared with to make sure that it's not oh, we can't do it now?
You got to do it when it happens, because after that period, you wouldn't be eligible for a special enrollment and you would be without health insurance. So our purpose is to make sure folks are enrolled so they have a health insurance, and that if something happens, we hate to hear that, you know, I didn't get my health insurance and now I have this bill for $150,000 and I don't know how I'm going to get it paid. We don't want to hear that, not because we don't want to, we just want to make sure people bypass that by having health insurance. And that's a worry they wouldn't have to deal with.
So when they call Resolute, they call you, what do they need to be? When I sit down with you, whether by phone,
right,
video chat, or in person, to make sure that I can walk away with everything that I need done so that I can get covered, what do I need to do? What should I, let's take
Let's
it
pretend.
Yeah, let's play. So I'm coming in and I need Marketplace. And with this, let me ask, is life-changing event still in effect right now?
Yes.
All right, so I come in and it's like, hey, I just moved here and I'm quarantined for 14 days, which is why I'm talking to you on the phone, but I need to get enrolled for health insurance. What do I need to have? What are you going to say that I need
I'm
to
going to say I need your name, I need your date of birth, I need your social security number, your address, if you are employed or not employed, if you
So I'm employed.
are self-employed, all of the things that you would need. Maybe you're employed and your employer doesn't provide health insurance. Then yes, we would try to sign you up for health insurance.
But what do I need to have for you to help me get signed up for health
Those things that I just mentioned to you. You don't need any money when you talk to me.
Okay.
I take no funds from you. Neither does the Marketplace at the time of completing the application. At the end of the application, you will know how much your health care is going to cost
But what about
via
like
the
my
marketplaces.
taxes? Do I need to have
So
my
you-
returns or anything?
If
of that
you
nature?
filed taxes in 2019, you can bring that form along with you, because that's your income estimate grid. But your income may be higher, your income may be lower, your household may be less. All of those things we're going to ask you.
But I don't
9 times in
necessarily
10
have to have-
people know what they made.
Right, but I don't have to have my tax forms right then?
No, but
Okay.
if you know what you made, we can put that in, we can estimate it for you, and then you can go back into healthcare.gov and go back in and put the correct information if it's off a little bit. There's a lot of steps that happen. If healthcare.gov sees that some information doesn't line up, they will send you a letter. They will give you time frames for you to get that information back into them, or you can fax it, you can mail it, you can come to my office, which is in Dayton, but
But you can come.
but you can come. Or I can meet you in the Hamilton County region, and we can go somewhere and have it scanned over for you.
Okay, so I've got all that information. I know how much I've made. I can tell you where I live and all that good stuff. How many people in my household? Is it how many people in my household?
Yes,
as well?
including
Is that
the
issue?
self. Yes.
But what if I'm only only trying to insure myself, which sounds kind of selfish, but maybe I'm the only one in the household that doesn't have health care. Do I still need everyone in the household?
You will have to say how many people are in the household.
Okay, so I've gotten all that. You've got all the pertinent information. Now, what's my next? I just kind of want people who've never done it, that process.
Is we've got all that information in there, and it'll start to tell us what is available for you, what policies, how much those policies cost, what the policy covers, what your out-of-pocket expense is, other than your monthly your monthly fee for your insurance, your co-pays when you go to the doctor, your co-pay for your medication. It gives you all of those types of things that you would need.
Okay.
Now,
okay.
After we go through all of that, say you pick a provider. Once you pick or select the provider, they will notify you. They will tell you that you selected a silver plan, which gives you a subsidy, and it'll tell you when your payment is due. It will also tell you once the payment is made, you will get your health cards, your prescription card. If you selected a dental and eye plan, all of those things will be covered from that aspect of it, because we're not the insurers. Mm-hmm. We're just those folks who assist you in obtaining the insurance.
So I remember when we first started this, there were like 125 plans or something like that.
They're not that many.
Not that many anymore.
A lot of people left the marketplace for various reasons, but I will say CareSource, Molina, Buckeye, United Health, Paramount is still in Ohio, and there could be some others that are available for you to select. The plans are based upon what your needs are, and you make that decision. We don't decide for you. We just answer the questions, and what we see, you can see. It's not like us seeing this and you're right there with us. It's
So is it still, what is it, platinum, gold, silver?
Bronze.
Bronze, and there was one more at one point that was like the bare minimum.
Yeah, I don't think they have that.
Okay, but the four,
I've not seen that.
But the four are still there.
Yes.
So can you just tell a little difference between from silver to platinum?
Ooh. It all depends on what
And I mean, not so much
company
like
you
select.
select. You might have, like, the platinum and the gold program is like your Cadillac program. Those are your best, which are a little bit more costly.
But a lesser deductible.
Less deductible. Then your silver plan might be a little bit more than the bronze plan, but it does provide you with that subsidy. There are some bronze plans that might provide a subsidy, but it all depends. You don't know until you go in there.
You got to get in there.
So you just can't just arbitrarily say, oh, but she said no. You got to go into the marketplace. You got to see what it's talking about, and you look at what it has and how it meets your needs.
It's kind of like that old lotto commercial they used to run on TV. To win the lottery, you got to play the lottery. So to get the insurance, you got to
come and play with us.
You got to play around what's in there. And then if I don't,
you can estimate.
Now if I pick one and don't like it, and I realize 6 months later, well, I'm paying too much, I'm going to switch down to the bronze.
You can't. You got to wait to open. You can't do that. You've got to wait to the open enrollment period. That's why it's best to come and have someone assist you and work with you. And if you have a life occurring or a life processing situation, say that you lose your job, you retire before you're 65 or 68.
Wouldn't that be nice?
There are things that we can go back in and look at because that does reduce your income.
Okay. Is there still the tax credit?
You no longer have to pay if you don't have health insurance. So that ruling is no longer, that's gone. Yeah.
but there is still, the subsidy is to help you.
Yeah, to carry the
to make
cost
that
for your
cost.
monthly premium that you pay.
Wow. So that's marketplace, and
Yes.
again, that's if you have your income, if you're single and it's over 17,000, maybe
Whatever.
500, somewhere
Yeah.
somewhere within there, then you're going to go to the marketplace.
Yes.
But now, let's say you're 16,000 a year is your income, and you're single. You're
You're
going
just
to Medicaid.
That's correct.
Right? But I want to go to marketplace, so I'm just going to skip Medicaid and just jump onto the
And
marketplace.
that probably won't happen.
then-
It'll probably kick it back
It'll
and
kick
say
you back.
that you are Medicaid.
Which will just delay.
Right.
So-
Because I've never seen that happen in all the years that I've been involved with it, where they're just like gonna, well, you can do this. It'll say that you are eligible for Medicaid, and they've sent it to the county in
So
which
it's
you live.
already sent. And the same as if you go to Medicaid and you're single and you're making 25,000 a year,
You're going to the
they're going to send you
marketplace.
to marketplace. And
Yes.
it's not like, well, I think I'll just stick with Medicaid.
No, even if you say at your job you get a raise and currently you're on Medicaid, that information goes straight into Medicaid. They will send you a letter of notification that tells you the date that your Medicaid will end, and you can go into the marketplace, and that would be a special enrollment.
Okay, so that's special enrollment. So I'm 16,000 a year, I'm single, and I need to get health insurance. And I like to mention every now and then that people sometimes confuse Medicaid and health insurance. You go, do you have health insurance? No, I don't have health insurance, but I have
CareSource.
CareSource.
Right.
And it's like, you have health insurance. No,
Right.
no, that's Medicaid.
Right.
Right? So, and I'm saying that because for some people it's confusing to them.
Right.
That you do actually have health insurance.
So, in the state of Ohio, we have expanded Medicaid. So, expanded Medicaid under the Affordable Health Care Act is a health insurance provider. So, it does provide you with the coverage that you need to do your preventive stuff. So, those things that you can do to keep yourself healthy is also important. So it's just based upon what your needs are, and it's really, I think it's wonderful that there are people like me that can do it. You still have Free Store Food Bank doing Medicaid. You still have the city of Cincinnati.
Are they still doing that Crossroads as well?
Yes, the Crossroads with Leslie is still there.
Well, just to be sure, Crossroads, the
Medical-
health center
Medical
down
centers on Liberty and Vine Street.
I don't want you going out to Oakley and then saying, wait, they said
No,
you
no.
would enroll me.
Right, so she's still doing it. Lincoln Heights is still.
Is Ed still there?
I'm not sure if Ed's still
Okay.
there, but they are still doing enrollment, and we still have folks in Butler County, and there are some folks still in Claremont, but we're not really sure where. But that doesn't stop you from calling Resolute or reaching out, because if that's where you live, we're going to get you to the people that live in your area.
And it doesn't matter that Resolute is in Dayton and
Right.
I live in Claremont County or in Hamilton County.
Or Warren or Butler.
Or any, if you're in Ohio,
In Ohio,
I can call you from Cleveland.
yes.
So if you're in Ohio, Resolute, look, you got Marjorie. Marjorie has been doing, let me give you a little props, because no, really. We started this together in 2013 before open enrollment started, because we both were working for Enroll America.
No, I was the volunteer. I was your volunteer.
Helping with Enroll America. and then not long after being the volunteer,
I became employed.
we became co-workers, terrorizing the state of Ohio. With me driving, of course, terrorizing the state of Ohio. But you've done this for so long. You've seen the ups and the downs. You've seen the providers come and go. You've seen the changes. And so, and the reason I wanted to bring that up is by saying that reaching out to you, and especially if you're able to talk to Marjorie, that you've got someone with a lot of knowledge on helping you, to help you, not make the decision for you, but to help you make very educated decisions that are going to work well for you, not just while you're sitting there, right? You're excited you're getting health insurance, and then 2 months later you're going, what did I get? But being able to help people navigate through a system that somebody might go, oh, it's simple, but usually when people say it's simple, it's usually not.
Right. It may be simple for me,
right,
but a lot of people may go into the system and then something happens and then they can't proceed on, and then we have to go either in based upon their information and see where it kicked them out, and answering the questions, you got to be honest. We help folks from other countries that are here in the United States based upon their status. They could be refugees, they could have a particular type of green card that puts them in a work situation in the United States. So there's various situations that allow folks to get health care here. And their citizenship.
Now, what about language barriers?
We do have interpreters. And if someone is not fluent in English, all they have to do is let us know. We can get an interpreter. Sometimes folks will bring their own family member to interpret for them, and we don't discourage that.
Right.
We want people to feel comfortable when they're coming to us, because sometimes it's very, very hard, no matter what their situation is, to come and tell somebody, I need this.
Right.
Can you help me? We want them to know that's what we're here for, and that's what we'll do. And if I run into a cliffhanger, I call Ron. You remember Ron?
Yeah, I remember Ron.
So Ron is our resident guru of healthcare, because he had been on the ground also with this company since we were on the ground with Enroll America.
Well, let's do this, because we only have a few minutes left. I just want to turn over the next 3 minutes to you to share whatever you think that we didn't hit, that you think people need to know about, or you want to get information out.
I want people to know that we are here to be of help to them, and that if I don't have the answer, I'm not going to just tell you anything to make you feel good. We want to help you get enrolled. We know that enrollment is down because of COVID. People have lost their jobs. Your children can be enrolled in CHIP. That has to do with healthcare for children at no additional cost based upon income. But the only way to find out is to ask. And Donna Washington and Brenda are still on the ground. So is
Brenda
Karen.
Dickens?
Yes,
Oh, wow.
And so is Karen. Haven't talked to Karen in a while, or Donald. But if I have a question and there's things I can't do, I know where to reach out to. Ariel is still on the ground. So we've reached out to her as well. We've recently all have gotten recertified for various levels of the work that we do. It is mandated by the state as well as the federal government. So understand, we put a lot of work into providing this to the community, and I just want to be that vehicle that can assist them.
So it's very easy for that to slip. So we're going to make sure that we keep reminding
Yes.
on here. Every time we do a show, we're going to let them know. It's kind of like the countdown to open enrollment. Go do it.
It's
All right?
like Medicare. Each of those entities have an enrollment period.
Right.
And it's important that people know in advance. So if they need to make changes, if they need to do something differently, that information is given to them in a timely fashion so they can make the best possible decision for themselves and or their families.
But until then, I want you to stay faithful, and please, with God's help, stay healthy. God bless you.